Hi, this is Dr. Theodore A. Lazzaro of Aestique Plastic Surgical Associates in MediSpa with the next edition of Dr. Ted Talks. Today I'm going to talk to you about a topic that many people have asked me about through the years. How was Aestique created and some history? Well, this magnificent building was first built in 1899 by a coal baron named Bugman. He erected it on 35 acres of wooded land that overlooks a beautiful vista. This remained his residency for close to 10 years, when in 1899, it became a toll house called the Rolls Mill Inn. This was a resting stop for the horses and for the travelers as they were making their way on their journey from Pittsburgh to eastern locations. In 1900, this once again became a residence, first of the Head family, and then secondly, the Fierce family. The Fierce lived there for a long time and raised 11 children. Correction, at 1970, after having been vacated for a while, this became a restaurant, initially called Treetops, then subsequently Stony Brook. Each one of these names took advantage of the captivating view from the facility. In 1980, after being again vacant for a while, the home was bought by a local contractor, Danny Marino, who I knew well. And I happened to, around that period of time, been looking for a new location for an office, as well as a surgical center. I purchased this magnificent building from Mr. Marino in 1986. Then we began on a 2-year crusade to renovate the building, which turned out to be a total gutting of the building and redoing. This was completed in 1988 and became Aestique Plastic Surgical Center. I had found that this was a wonderful location, not only to do the surgery, but the patients embraced it. The Disney-like customer service and being in a what appeared to be a European manner. Also, that it was cost effective, much more cost effective than doing this in the hospital. So I expanded on this concept and thought that patients of other surgical specialties should be able to enjoy this as well, of having that same type of experience. So in 1990, we were licensed by the Department of Health and also by Medicare. So we had state and federal accreditation as a multi-specialty surgery center. We continued this for years with a very high patient satisfaction level. In 1994, Unity Township, which had not had zoning up to that time, were zoning all the different parcels in the township. We were zoned as R1, which was residential, but giving and grandfathered as a multi-specialty surgery center. In 2001, we converted the then previous carriage house into a medically based med spa with medical supervision. This fit in nicely into the plastic surgical practice because it associated non-invasive and non-surgical medical procedures that could be done prior to doing a surgical procedure to maintain patients' wishes and desires to look as good as they could feel. We continued this, and after the first year, we were interviewed in 2002 by the American Board of Plastic Surgery, who was doing an article on how you can incorporate a plastic surgical practice, incorporate a medical spa into your plastic surgical practice. They also interviewed another practice in New York City and another in Beverly Hills. We were honored by them featuring Aestique in their national and international magazine of how to do this incorporation into your plastic surgical practice. In 2011, we expanded and put another office into Pittsburgh at Aestique Shadyside. This was to satisfy the demands of many of our patients that came from Pittsburgh who didn't not only mind coming out to our Greensburg location, but having their procedure done into the surgery center, not having to go in the hospital, less infection, and also a Ritz-Carlton-like atmosphere, Disney customer service, and much more cost-effective. So we continued in this manner, and we're offering other services such as ophthalmology, doing cataracts, pain surgery, stimulators, doing GI, podiatry. Then in 1994, Unity came, then in 2019, with this concept of flowing again with a very high patient gratification level, we decided to expand our services, as many surgery centers were doing across the country, of finding a more value, less cost alternative. We went back to Unity Township to get rezoned, which they were very helpful and accommodating. We were rezoned to do the expansion, and also given the ability to keep patients overnight, which we think now including things like orthopedic for joint replacements and minimally invasive spine procedures. If there was a necessity to keep people overnight, we could bundle that price and still do it in a much more cost-effective manner. On average, our fees for the same procedures that are performed in the hospital, for the hospital facility fees, are about 50% less. In closing, I want to answer a question that is asked me many times about the origin of the name Aestique. And this was, I wanted to combine something of beauty and something of allure, which I thought this building projected. Aesthetic surgery is the type of surgeries that we do often, and many of the different procedures we do are of an aesthetic nature. So I wanted to have that name incorporated into the name of the building. And also, when you went there, there was an aura or an aesthetic, a mystique present. So I combined the two names, aesthetic, the beginning of that, and mystique, the end of that, and came up with Aestique. And I think this truly does portray the feeling you get, the service you get, and the gratification that we experience from people who utilize it. I hope you too will find the time to utilize this and the different services there. I am quite certain you will be happy you did. Please stay well, stay safe, and stay positive.